Oh, what's up, everybody? It's Wellness Week Live. I am your host, DJ Anthony. I'm a real DJ. No, seriously, that's what I do. But today, or when you're seeing this, or maybe no, after you're seeing it, before you're seeing it, I don't know. But anyways, I got myself a endoscopy. What is it? Why should you get it? Why you shouldn't get it? I don't know. But this is my review of my endoscopy. And by the way, I'm not a doctor. I'm not giving any medical advice. Don't listen to me. Always check with your healthcare professionals. Okay, but this is my review. Endoscopy. Ready? Cake walk. Okay, now I'm talking to the guys out there because I know you chicken. The women are a little bit more brave than us guys. But listen, let's break it down. Okay, so why would someone need an endoscopy? An endoscopy is this end, and then you have the colonoscopy on the other end. I did a show on the colonoscopy. You could probably go into the archives here and check that out. So colonoscopy, also cakewalk, but more prep. Endoscopy, really no prep, so to speak. But let's break it down. So, why does somebody need an endoscopy? So, for me at least, I don't know about everybody else, but for me, for years, I've been having a lot of heartburn, basically GERD, gastroesophageal something. Yeah, I've been having a lot of heartburn, but there's a difference between GERD and heartburn. Heartburn is once in a blue moon, like you get it once a month. GERD is when you're getting it like weekly, the heartburn. Then you've crossed the line, you done did it, you're having this pattern. Okay. So if you have GERD and and if you have it as a pattern, meaning for, I don't know, months, in my case, years. And I was like, yeah, I'm gonna go to the doctor. So eventually I'm like, you know what? I pulled the trigger. I'm like, I gotta go. I gotta go because this heartburn is kicking my ass, and of course I was taking over the counter stuff, whatever, to manage it, mitigate it. And I was trying to watch the foods that I ate, but not really. But now I'm on it. Anyways, so you go to get an endoscopy, and again, for my case, is usually if you have heartburn or GERD, and it's like been some time, not a couple of days, not a couple of weeks, not a couple of months. I'd say if it's becoming a yearly thing, and you can't figure out why, or you're not willing to change your eating habits, or you're drinking a lot, you're smoking a lot, things like that. So that's why you get an endoscopy. There's probably other reasons, but that's why you would get endoscopy, and you would go to a gastroenterologist. Typically, would do the endoscopy. Uh, so let's go down the list here. So prep. What's going to happen when the doctor's like, you need an endoscopy? Now I know what an endoscopy is. I always knew it was not a big procedure, but who the hell wants to get these things, right? So the doctor's like, yeah, I'll do an endoscopy. I'm like, oh shit. No pun intended. That's the other way. But anyways, so I was like, all right, I'm gonna do an endoscopy because you want to check, because if you're having this GERD or heartburn for months and years, the reason why you get this endoscopy is so the doctor can put a camera down there and take a look at your esophagus and then your stomach to see, has your stomach acid, worn out your esophagus lining, and if that is the case, you could have some problems down the road, possibly, and hopefully not, but could be cancer, things like that. It could, if you're not keeping that esophagus and your stomach lining in check. They could also check for hernia, hiatal hernia, I believe it is. So that's why you're checking down there with the camera. And there's other tests they can do, you know, like spit tests, I believe, to see if you have, or even a breath test maybe to see if you have e type of bacterial strain that's causing heartburn too. But the camera's like the golden, the golden level. So that's why you go to get an endoscopy. So that's why I went for the heartburn thingy. So okay, prep. And by the way, yeah. So my endoscopy, the doctor's like, bro, you're fine, you're good to go. So that's that. I'm like, oh, cool, all right, because I'm breathing fire, bro. But and they'll put you on medication possibly and things like that, and I've done that. But so I'm gonna jump around a little bit. The whatchamacallit, yeah, and they might take a biopsy just to make sure, like extra sure, and they did that with me too. So, and that's fine, you don't feel anything. The prep for endoscopy, so it's not like a colonoscopy. You're not going to be drinking the shit, so to speak, and pooping and this and that, and you can't. There's really no prep other than you just can't eat the day of or drink the day of, kind of like if you were, I don't know, going for a physical, so just you can't eat 8 hours prior to your procedure, and it's a procedure, it's not an operation. There's two different things. And you can't drink water 4 hours prior to the endoscopy. Now, why that is, I actually don't know. My guess is it has something to do with anesthesia. And of course, if you have a full stomach and you just ate, they're not going to be able to see probably as well down in there, but that's my guess. You're going to get there to the area early to the medical place, whether it's a hospital or an outpatient standalone office. I went to an outpatient standalone office. And so you get there, you got to fill out some paperwork. You're going to usually get there early, 7 o'clock in the morning or 8 o'clock in the morning. It's an early thing. You're not going to go there at 2 in the afternoon. At least I didn't. So they'll prep you and you'll fill out some paperwork. You wait in the waiting room and then they'll call your name. Like, yo, Tony. And I'm like, oh. And so then you go into the medical kind of area where it's a little more hospital-esque. So out of the waiting room into this, like, there's all these, I guess, like rooms or, dividers with curtains, and all the patients are waiting for their endoscopy or colonoscopy. So you're just hanging out there. You have your own privacy. And then they'll be like, okay, take your clothes off, get sexy, just down to your undies. And then you got to put the gown on. You do that in private in a little locker room, and you put your clothes in a locker. You lock the lock, you give it to the nurse, to the tech, and then they hold it. And then what else? You hang out. You're going to hang out in this little area. You're going to be a little chilly because it's, medical places, especially when you do procedures, whether it's surgery or a procedure, they're usually a little chilly. So they, at least for me, maybe because they knew I was DJ Tony, but they brought up a nice hot blanket, put it on my legs. So, so you chill out there, and then they wire you up. I guess they take your EKG, your pulse, this and that, make sure you're alive. They'll ask you a bazillion questions. Are you on any medications? Do you have any, metal implants, anything and everything we should know about, did you take Advil or whatever it is, they'll ask you everything and anything to go through everything. And if you have any questions, or things you got to say, you say. What else? So they'll just, wire you up, put the, little needle in your arm. And I say little needle because I donate blood for charity, and those gauges are ginormous. The needle they prick in you for the anesthesiologist to run an IV is like, you're not even gonna know you're not even gonna know it's there. So don't be a baby. So they you hang out there, they wire you up, and so let's just say you get into the place at 7. By like, depends on where you go, but for me, I got into the place at like 7:30. By right away, I filled out some paperwork. By 8 o'clock, I was in the other room, all naked and not in front of anybody, but the gown on. And by 8:30, I was doing the procedure. So the procedure for the endoscopy, maybe 10 minutes. I mean, really, really fast. So don't forget, you're dealing with pros here. These people, they do this their whole life. This is what they've been training for, is what they do. So to them, it's like making a peanut butter and a jelly sandwich. So, they got it down to a science, which is good. So the nurse will come in when you're getting prepped. The MD comes in, the anesthesiologist comes in, the tech comes in. They're all going to ask you the same question over and over as redundancy. Okay, everything okay? Are any medications? Did you drink or eat anything? Blah, 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 blah. You're like, I got to answer the same questions over and over again. So they'll walk you into the room. They're not going to wheel you in. They'll walk you in to a little room, and you'll have your little socks on because you have to get butt naked. Like I said, you have the gown on, you get your socks on, and they give you socks and they give the gown. So they walk you into the room, and there's your doctor, there's your anesthesiologist, there's your nurse or your tech, and I think that was it. And the room is like the size of a bedroom, but it's not a bedroom. It's like it looks like an OR, but it's not. And then you lay on the bed, and they'll put the little oxygen in your nose. They'll put the little EKG thing on your finger, and then they'll put this like plastic mouthpiece in your mouth with a hole in it. Or it looks like it's like a mouthpiece, like a football mouthpiece, except it has a hole in it. That's where they're going to run the camera down. And it doesn't hurt or whatever. Put it in. You look freaky. You're like, oh, whatever. And then, they'll be like, all right, count down from 10 or whatever. We'll just watch you. You die. You doze off. I almost said die. You don't want to die. you doze off. But and they were like, yeah, you count backwards from 10. I'm like, bro, I ain't going to go to sleep. So I'm like, yeah, whatever. 10. And then, so you're out, dude, and it's like a light anesthesia, I guess, as opposed to heavy. I don't know what that means because you're out. And then, they put the camera down there. You're not going to feel any of this. But what else? And then, like, I don't know, 10 minutes, 15 minutes later, you wake up, you're like, huh? And you're like, oh, that was a good nap, actually. And then you're in the whatever waiting room again, like the recovery area where you were first in, where they were prepping you. And then, you're just chilling out and you're like, and you may or may not have a scratchy throat or a sore throat. Depends. I thought I was going to have more of a sore throat. I had nothing. I was like, oh, that's odd. So cool. And then they'll offer you something to eat or drink, like cake or cookies or something soft, water or juice, something like that, to kind of just get you kind of woken up again. And so I took the pound cake, and I could have kept on eating that. That was pretty good, actually. So oddly enough, they told me that patients have an option. You don't have to have anesthesia. You can go get an endoscopy with no anesthesia. I was like, bro, who does that? And I guess it's not an invasive procedure because they're not punching a hole into anything. The hole is already there. But I'm like, bro, I don't know, man. Like, the doctor's like, yeah, you don't want to have no anesthesia. You want to have anesthesia. And some people, very few, but some do get it, and they'll spray your mouth with like a numbing agent just so you don't gag, and you could be up. And I would probably say you want anesthesia, not for pain, but because you don't want to move or anything like that. Like, you know what I mean? You want it to be as still as possible. You don't want to, F this up. And it's a relatively simple procedure. You don't want to overcomplicate things. So just take a nap. So the procedure is maybe 5 minutes actually, but yeah, I guess about 10 minutes. And then what else? So they'll look at you, they'll look for any inflammation or any redness or anything that would stand out to the doctor's eye. They'd be like, oh, this is bad, on the television screen. And they'll probably take a biopsy just to be extra safe. And like I said, my doctor's like, everything is good. I'm like, that's cool. What else? Afterwards, so when you leave post, you'll wake up from a nice little nap. Your throat may or may not be itchy or sore, depends. That's normal. If it is sore, it's fine. It'll last maybe a day or so. You have to have a friend or somebody, a family, pick you up. I thought I could take Uber. So they're like, nah, it's got to be. So I called my friend. So, thank God for friends. And what else? You we'll get some, like I said, some juice and stuff like that afterwards. The nurse or tech will bring it by. You'll be a bit groggy, it's anesthesia. I mean, not even groggy, but like a little like dizzy, lightheaded. So you got to just chill out for 10, 15 minutes, like just get your bearings straight, and then you'll be able to get up. And as the minutes go by, you gain your balance better and all this stuff. Don't think you're popping up like you're running a marathon. You're not. What else? You'll be they'll call your ride actually, so they'll ask you before you go into the procedure, like, who are we calling or texting to tell them that you're ready to be picked up. You can't walk out of the place by yourself. That you have to drive the car right up to the front door to pick you up. You can't walk in the parking lot to the car. Your friend or family or whoever is going to pick you up has to almost pick you up. Like, even though you're like, I'm fine, doesn't matter, like, because your safety, And so what else? After you get out, you're probably going to feel fine-ish, fine, but you can't exercise, you can't go, running around or operating a car or any kind of equipment. If you have a desk job, you probably could go back to work, I guess. But yeah, there's nothing, you got to just take the day easy, so to speak. You don't have to go home and go to sleep, although you may want to, but you just got to, go easy, So, and that's it. And then food is the only thing that would stop you from eating. You can eat whatever you want, but if you have a sore throat or a problem swallowing, you probably want to have like softer food, maybe, I don't know, puddings or cream type of stuff, maybe some soups, mushy bread. You don't want to be like, I'm gonna knock down a bag of nuts, probably not the best thing. But yeah, my throat felt fine. I was like, I probably could eat a bag of nuts, but I was like, you know what, let me go easy, whatever. What else? So that is about it, I think. So yeah, I mean, if you need one, don't be a sissy, go get it. You know what I mean? Like, if you have to get an endoscopy, get it. It's actually very easy. Colonoscopy is easy too, but it has more prep, and yeah, not to go into the colonoscopy thing. I already did a show on that. You can check it out. But so endoscopy, that's why you would get it. That's what happens pre, during, and post. What else? That's it. If you have any questions, let me know. And Yeah, so my heartburn is improving because I'm really, really taking a hard line stance. I'm cutting out a lot of foods and a lot of types of drinks. So basically, I think I did a show on heartburn already. But if you are drinking or eating a lot of acidic foods, and the funny thing with acidic foods, like there are foods that you don't think are acidic, but they are. So it's like, damn it! Like I just found out, like blueberries are very acidic. I didn't think they were. I thought I knew oranges are, but I didn't think blueberries were. And blueberries are, and I love blueberries, so I stopped that. And I love sushi, and have to cut down on that. So you may say, well, what kind of living is that? What? Well, I don't want to be on meds. So that's the problem, because medication solves one problem but gives you five new problems. Do the math. You're not going to win. So my thing is I'm taking a very, very strict hardline thing. And if there are moments in my life where I'm like, yeah, I really do want that spicy food or that, sauce or whatever, then I'll just take some antacids prior or after and I'll have it, but I can't have it as part of my diet or part of my life anymore because, like I said, I don't want to be on meds. And so you have to really look at, are you smoking? Are you drinking? Are you overweight? Do you get exercise? All these different things that can give you GERD or acid reflux or heartburn. And again, heartburn once in a while, like once a month, you don't need to go to the gastroenterologist, in my opinion. But if you're having it, several times a week and it's been months and years now, you probably need to go see a doctor, And so, anyways, that's it. That's what you can expect if you get an endoscopy. Very, very common, easy procedure. Easy for the doctor, right? When you're doing it, when it's happening to you, you're like, you're nervous, and I was nervous too. But it is one of the you know safest, easiest things to do in the scope of operations and procedures. You know what I mean? Like the doctors know what they're doing. And so, anyways, if you suspect you have a pattern of, again, GERD or acid reflux, more than just once in a blue moon, go see your doctor. Don't be a baby, okay? Don't be a sissy. And nobody's a bigger chicken than I am. So if I can do it, you can do it. Not a big deal. All right, everybody. That's it. I talked enough. Check back in. A lot of great content coming up, everybody. Okay, thank you. DJ Tony over and out. 5, 4,